In a world rattled by nuclear-sized threats and war, a summit taking place in the French city of Lyon to draw attention to those other killers: pollution, global warming, the spread of diseases like malaria and dengue fever through mosquitoes, and the One Health Summit convening at a time of slashed budgets for research and international aid. And it's not just the United States. France's Emmanuel Macron addressing fellow leaders and scientists.
75% of emerging infectious diseases originate in animals. This figure alone justifies today's meeting. And for those of us who just a few years ago experienced a virus that brought our economies and societies to a standstill, causing us to endure such a cruel situation in so many of our countries, the COVID-19 pandemic, no one has forgotten how quickly this epidemic spread across the globe in a matter of weeks.
And that brings us to our Spotlight segment. And joining us from Lyon, the One Health Summit, Jozef Síkela, European Commissioner for International Partnerships. Thank you for being with us here on France 24.
Thank you very much for the invitation. Good afternoon.
You heard the French president there allude to the COVID pandemic. Where does the next worldwide pandemic come from?
I don't know what is the next one, but we know that basically the prevention is much cheaper than the reaction, and therefore we need to use this day, the World Health Day, for new initiatives because this is a very decisive moment. This is very critical for global health, as the diseases does not know the borders, and we have a combination of very negative factors, and therefore we need to set up a new approach. The global warming is basically triggering new diseases. The biggest donor so far is basically retreating from the global health issues, and the global development assistance is shrinking as well. Therefore, it is important to send a strong signal that Europe remains committed. I announced today basically a package of 800 million current and future commitments, and we will come next month with the Global Health Resilience Initiative, where we basically will formulate our views on our architecture ecosystem and how basically to keep the global health system up and running.
Yeah, the EU with a bigger budget when it comes to this, but that's kind of bucking the trend, as you just explained. It's a bigger budget, but included in that, is it all for healthcare, or does some of that go for trade initiatives as well?
Basically, the announced 800 million, this is really a health initiative. So this is partially, and I announced already today, 185 million available immediately, which is going for global fund for AIDS, tuberculosis, and malaria. One of the most successful health initiative historically. This fund has saved around 65 million lives since the foundation. We will also increase the support for science and research. We will also increase our support for the 6.5 million for better coordination in the One Health scope. So basically this 46.5 million are going basically in coordination of the Europe CDC activities, so ECDC, Africa CDC, and coordination with the European Food Security Agency.
Have you been able to sort of draw a conclusion from the year 2025, Jozef Síkela, with this slash in budgets, how it's affected concretely things like the fight against AIDS and malaria? What is right now, do you have numbers that tell us exactly what the effects of that slashed aid from last year will be?
I was talking about the global impacts of pandemics, and this is something what we have to prevent for the future, because we know the bill for the COVID, and basically Europe paid trillions of euro for tackling basically COVID and its consequences. So basically the new approach, the new global health resilience initiative should basically bring a new approach when it comes to architecture, when it comes to ecosystem. So we have to, with less resources, do more. We have to avoid redundancies. We have to avoid competition for the mandates. The WHO should basically steer the activities, and the other participants should deliver what they know the best. We have to increase the resilience of the countries, so the country-led health system, and we have to also increase the preparedness and health security regionally and globally. We have to diversify supply chains and build a local manufacturing. We did a lot in the past, but we have to continue with this approach and with basically supporting the vaccine production in other continents. And what we have to do as well is basically put the science and the fight encountering misinformations and the disinformations in the heart of our effort.
Yeah, things like having a vaccine skeptic as the U.S. Health Secretary. How does that impact the rest of the world? How does it impact Europe and the rest of the world?
Well, I was talking about a 65 million saved life, and basically this is the approach we want to continue with. And I was talking about putting the science in the center of our effort. And I think, you know, to continue basically saving the lives is, I think, a pretty good thing.
You talked at the beginning about prevention being cheaper than treatment when it comes to these global health challenges. Prevention begins with research, with funding and research cut on both sides of the Atlantic. How do you make that research happen?
Well, what we want to do is basically to combine the European know-how and the European science and research coming from the universities, from public and private institutions, from basically control centers, and partnering with other countries through the transfer of know-how. I was mentioning the MAV plus vaccine production in Africa, where we invested basically 2 billion euro in different countries. And this is about a collaboration. This is about a mutual partnership. And this is basically the European value proposition. So we basically want to keep the multilateral approach also when it comes to global health.
Multilateral approach. When you're the European Commissioner for International Partnerships and say you go to Africa, what's it like in 2026 if you're competing with, say, the United States, which has taken a more transactional approach? They want precious minerals in exchange for helping out.
The mutual and beneficial partnership is our value proposition. So when it comes to health, we do. It works because basically there is a strong demand for more Europe. Not everybody likes the conditionalities, and I think the co-creation and the value creation, the focus on the job creation, on the value chain creation in our partner countries is something what is helping them to solve the major problems. I was talking about climate change. I am talking about the demography. We will see 50 million new young African entering the labor market, and we have to offer them the sustainable future. And the sustainable future is about the jobs, about the quality jobs, but it is also about the healthcare, about the education. And this is our way how to tackle also the root causes of the migration and this is basically our way how to fight the global instabilities, because the regional instability is easily becoming a global one, and it doesn't matter if it is like a pandemic starting with a disease in one country. So basically, the aim is to help to increase the economic strengths of our partner countries and also their health, security, and resilience.
And one quick final question. You had countries like France, like Germany, that reduced their budgets in this regard last year. Did you slip a word to Emmanuel Macron about it?
As I said, we have to do with less more. And this is about a focus, and this is about the priorities. We cannot do everything everywhere a little bit. So basically with the right focus, with basically removing the redundancies, with basically removing the fights for the mandate, with basically selecting the right partners for the right topics, I think we can bring not only more transparency, but also like more results in the whole approach.
Jozef Síkela, so many thanks for joining us from the One Health Summit in Lyon.
Thank you very much. Have a nice day.
You too. Stay with us. There's more to come. More news plus the day's business. And in sports, we raise the curtain on the quarterfinals of the Champions League. Stay with us.